Hi, Dr. Jeff with Orange Wellness. In this video, I would like to discuss what is a herniated disc and what are the treatment options. So a herniated disc, you'll hear this a lot. It's very, very common. So the disc is the pad between the bones it's between the spinal bones that acts for shock absorption and weight distribution. And there's a little gel in the middle, like a jelly center, almost like a jelly donut. And the jelly in the middle is supposed to absorb the shock. But sometimes that gel or jelly middle pushes out through the outer layer. That means it's herniating out, and that is called a herniated disc. You'll also hear the terms ruptured disc, bulging disc, and all these other types of terms. So a herniated disc is when the jelly pushes out, it causes the outer edge of the disc to bulge and then press on the adjacent nerve that's leaving the spine. That nerve, depending on where it goes, will give you pain in that distribution. So if you have a neck herniated disc, it might pinch a nerve as it leaves the neck to go to the arm, and your main symptoms can be shoulder or arm pain or tingling or numbness in the hand or fingers. If it's in the leg, you're going to get sciatic type of pain. And low back herniation will compress the sciatic nerve, will give you sciatic pain, tingling, numbness, pins and needles in the toes and feet and that type of thing. It is extremely painful. It's one of the most painful conditions that we see that anyone can experience in life, pretty much. It can be very debilitating. So what are the options for treating a herniated disc at our office? Well, first and foremost, we have chiropractic. We do chiropractic adjustments, and one of the main adjustments we do is called flexion distraction technique. It is one of the many techniques that chiropractors have. It's a special table that uses traction with movement. It helps open up the joint and allow disc to retract back in. There's another treatment called spinal decompression or non-surgical spinal decompression. And we have two tables. One is called a VAX-D and one is called a Triton. These tables are specifically designed to stretch the spine, open up the disc space, and allow a negative pressure to occur inside the disc. A negative pressure is a vacuum, and a vacuum has a suctioning effect. So the jelly that's herniating out is literally slowly suctioned back in and off of the nerve, providing great relief to the patient. So these are just a couple of the options that we have. There are others as well, but I just wanted to touch on what a herniated disc is and what a couple of basic options are. A couple of options you really don't want to consider unless you really have to is surgery and injections within the spine. But those will come later after the conservative measures maybe haven't worked. But for most people, the good news is our conservative measures work very well. I hope you enjoyed this information. Please leave a comment and share the video. Send the link to a friend or family member and check out our website at orangewellness.com. Thank you.